The pediatric cardiologist in Minsk picks up the ultrasound probe. Another newborn. Another examination. The screen flickers to life. She freezes. The heart has 5 chambers instead of 4. The aorta branches in the wrong direction. The ventricles are fused. She has been a doctor for 20 years. She has never seen anatomy like this. This is the 3rd case this week. All born in 1987. All mothers from the same region. 50 miles from Chernobyl. This is not medicine anymore. This is something new. Something the textbooks never prepared her for. This is the story of the Chernobyl children. The ones born after April 26, 1986. The ones whose cells were altered by radiation while they were still embryos. While their organs were forming. While their DNA was being copied. This is about the doctors who discovered unprecedented mutations. The medical mysteries that still have no answers. And the children who became living evidence of what radiation does to human development. This is clinical. This is scientific. This is horrifying. Let us start with the invisible enemy. Radiation from Chernobyl was not one thing. It was a cocktail of isotopes. Iodine 131, cesium 137, strontium 90, each with different properties, different half-lives, different targets in the body. Iodine concentrates in the thyroid. Cesium spreads everywhere. Strontium mimics calcium and deposits in bones. Pregnant women absorbed all of them. Their developing fetuses absorbed all of them. At the most vulnerable time in human development. The first trimester of pregnancy is when organs form. Week 3, the neural tube closes. Week 4, the heart begins beating. Week 5, limbs start budding. Week 8, all major organs are present. This is called organogenesis. It is the most radiation-sensitive period in human life. A single mutation during this time can cascade into catastrophic malformation. The children of Chernobyl were exposed during every stage. In utero, during organogenesis, during cell division, during DNA replication. The results were predictable and unprecedented. Dr. Yuri Bandazhevsky was a pathologist in Gomel, 50 miles from Chernobyl. In 1990, he started performing autopsies on children who died from heart failure. These were not normal hearts. The muscle tissue was wrong. Fibrosis where there should be muscle. Scarring in infant hearts. Electrical pathways disrupted. He measured cesium levels in the heart tissue. They were astronomical, 50 times higher than in other organs. Cesium was concentrating in cardiac muscle, disrupting cellular function, causing what became known as Chernobyl heart. Chernobyl heart is not one condition. It is a spectrum of cardiac anomalies. Septal defects where walls between chambers fail to form. Transposition of great vessels. Hypoplastic left heart syndrome. Interrupted aortic arch tetralogy of Fallot. These are complex congenital heart diseases. They require multiple surgeries. Many are fatal without intervention. Before Chernobyl, these conditions were rare. After Chernobyl, they became common. In some regions, the rate increased 300%. Dr. William Novick is an American cardiac surgeon. He traveled to Belarus in the 1990s. What he found shocked him. Operating rooms filled with children needing heart surgery. Multiple defects per patient. Hearts with anatomy he had never seen. Some chambers were backwards. Some vessels connected wrong. Some hearts had extra holes. Some had missing structures entirely. He operated on 13 children in one trip. All had Chernobyl hearts. All were born after 1986. All mothers were exposed to fallout. But hearts were not the only organs affected. Neural tube defects exploded across contaminated regions. The neural tube forms the brain and spinal cord. It must close properly in the first month of pregnancy. If it fails, catastrophic defects result. Anencephaly, where most of the brain is missing. These babies die within hours. Spina bifida, where the spine does not close. Fluid leaks. Nerves are exposed. Encephalocele, where brain tissue protrudes through skull. Microcephaly, where the head is too small. Brain development arrested. A study in Belarus tracked neural tube defects from 1982 to 1993. Before Chernobyl, the rate was stable. 2 cases per 10,000 births. After Chernobyl, it jumped. 5 cases per 10,000. Then 8 per 10,000. The increase was highest in contaminated regions. The pattern was clear. The timing was clear. The cause was radiation exposure during early pregnancy. The science was undeniable, but officially it was denied for years. Limb malformations followed similar patterns. Radial aplasia, where the radius bone never forms. Clubfoot at abnormal rates. Polydactyly with extra fingers. Syndactyly with fused digits. Phocomelia where limbs are shortened or absent. These are severe structural defects. They require multiple surgeries. They cause lifelong disability. The rates in contaminated regions were double normal. In some villages, triple. The correlation with distance from Chernobyl was perfect. Closer meant higher rates. Further meant normal rates. The thyroid cancers were the most documented. Iodine 131 concentrates in thyroid tissue. Children have small thyroids. High metabolic rates. They absorb more radioiodine. They received massive doses. In Gamal, the thyroid cancer rate increased 10,000 times. 10,000 times higher than before. In children under 15. This is unheard of. Thyroid cancer is rare in children. Gamal diagnosed hundreds, then thousands. By 2000, over 1,500 cases in Belarus alone. These are not normal thyroid cancers either. Papillary carcinoma usually grows slowly. Chernobyl cancers were aggressive. They grew fast, metastasized early, spread to lymph nodes, invaded surrounding tissue. 45% had advanced stage of diagnosis. 46% had lung metastases. In children, radiation-induced cancers behave differently. More aggressive, more lethal, harder to treat. Dr. Yevgenia Stepanova led screening programs in Ukraine. She examined tens of thousands of children. Physical exams, ultrasounds, biopsies when needed. She found nodules everywhere, abnormal growths, suspicious masses. Many turned out benign, but hundreds were malignant. She published her data. International journals accepted it. The evidence was overwhelming, but funding dried up. Political pressure increased. Her research was discouraged. Then there were the invisible effects. Genetic mutations that caused no obvious deformity, but disrupted cellular function. Mitochondrial damage, DNA repair defects, chromosomal instabilities. These children looked normal, but their cells were not. They had higher cancer rates, higher infection rates, immune dysfunction, chronic fatigue. The term used was radiation-induced genomic instability. Their DNA repair mechanisms were damaged. Mutations accumulated faster than normal. A 2021 study compared children of Chernobyl liquidators to control groups. They found cluster de novo mutations, multiple mutations close together in DNA. This pattern indicates radiation damage. The mutations were in the children, but came from parental exposure. Transgenerational effects. The radiation damaged parental germ cells, sperm and eggs. Those mutations passed to children, written into their DNA forever. Mental asylums in Belarus filled with Chernobyl children. Severe cognitive disabilities, developmental delays, autism spectrum disorders, behavioral problems. Some could not speak, some could not walk. Some needed institutional care for life. At Novinky Mental Asylum, staff reported dramatic changes. Before Chernobyl, mild disabilities were common. After Chernobyl, severe disabilities became normal. Children with profound impairment, unable to care for themselves. The numbers grew every year. A UNICEF report in 2010 found 20% of adolescents in Belarus had chronic illness or disability. 1 in 5. This is catastrophic. Normal population rates are 5 to 10%. Belarus had double. The geographic correlation was perfect. Contaminated regions had highest rates. Clean regions had normal rates. Belarus absorbed 70% of Chernobyl fallout. Belarus paid with a generation of damaged children. Psychological effects were equally devastating. Depression rates soared. A screening of 116,000 Ukrainian adolescents found 13% with clinical depression, 5% with suicide ideation, 2% attempted suicide. These were children exposed in utero or early childhood. They grew up knowing they were Chernobyl children, knowing they were damaged. The stigma was crushing. They were called atomic children, radiation babies, mutants. The psychological trauma compounded physical illness. Researchers try to quantify the effects. Studies published in medical journals. Data on congenital malformations. Birth defect registries. Hospital records. The patterns were consistent. Neural tube defects increased. Heart defects increased. Limb malformations increased. Thyroid cancers exploded. The temporal correlation was perfect. The geographic correlation was perfect. The dose-response relationship was there. Higher exposure meant higher rates. But international organizations downplayed everything. The World Health Organization issued statements. No effects on fertility. No effects on pregnancy outcomes. No birth defects expected. This contradicted published research. It contradicted hospital data. It contradicted what doctors were seeing. Political considerations overrode science. Nuclear power interests influenced reporting. The truth was buried under bureaucracy. The ICRP established thresholds. Below 100 milligray, no malformations expected. This was based on animal studies, not human data, not Chernobyl data. It ignored low-dose effects. It ignored chronic exposure. It ignored sensitive populations. Pregnant women and fetuses are the most sensitive. The 100 milligray threshold does not apply, but it was used anyway. To deny, to minimize, to dismiss. Individual doctors fought back. They published case reports. They presented data at conferences. They documented what they saw. Dr. Bandaszewski was arrested, charged with corruption, imprisoned for years. His crime was measuring cesium in children's hearts. His crime was publishing data. His crime was telling the truth. He became a political prisoner for doing science. Some children survived and thrived. Thyroid cancers were treated. Many went into remission. Heart defects were repaired. Surgeries saved lives. But the scars remained. Physical scars from operations. Psychological scars from trauma. Genetic scars in their DNA. They carry Chernobyl in their cells. It is permanent. It is measurable. It is undeniable. The question haunts researchers. How many were affected? Official numbers say hundreds, maybe thousands. Unofficial estimates say tens of thousands, maybe hundreds of thousands. Birth defects that went unrecorded. Stillbirths not counted. Spontaneous abortions not tracked. Children who died young. The true toll will never be known, but it is vastly higher than admitted. Today those children are adults. The babies born in 1987 are 39 years old. They have their own children now. Will the mutations pass forward? Some studies say no. No transgenerational effects detected. Other studies say yes. Cluster mutations in offspring. Genomic instability inherited. The data conflicts. The science is incomplete. The question remains unanswered. What we know for certain. Radiation exposure during pregnancy causes birth defects. Chernobyl released massive radiation. Pregnant women were exposed. Birth defect rates increased in contaminated regions. Neural tube defects, heart malformations, limb abnormalities, thyroid cancers, all increased. The timing matches. The geography matches. The dose-response matches. The causation is clear. What remains unknown? The exact number of affected children. How many died undiagnosed? How many subtle effects went undetected? Whether genomic instability passes to grandchildren. How long the elevated rates will continue. Whether other health effects will emerge. What the full genetic damage looks like. How many lives were truly altered. The children of Chernobyl are living evidence of what radiation does to development, of how invisible particles alter DNA, of how a single disaster echoes across generations. They did not ask for this. They were conceived in contaminated regions. Born into contaminated world. Their cells absorbed isotopes. Their DNA accumulated mutations. Their organs formed wrong. Their lives were damaged before they began. This is not fear-mongering. This is documented medical fact, published in peer-reviewed journals, recorded in hospital databases, measured in tissue samples, seen on ultrasounds, confirmed by autopsies. The science is sound. The evidence is overwhelming. Only politics denies it. The lesson is brutal. Radiation does not care about thresholds. It does not care about safety limits. It does not care about international guidelines. It damages DNA. It disrupts organogenesis. It causes mutations. The most vulnerable pay the highest price. The unborn, the children, the ones with no choice, the ones who trusted that the world was safe. Chernobyl's children carry the proof. In their hearts, in their thyroids, in their DNA. They are the experiment we never should have run. They are the data we try to hide. They are the truth we cannot deny. Radiation changes human development. Permanently, measurably, tragically. And that truth is written in the bodies of a generation. The generation born after the reactor exploded. The generation that science failed. The generation that politics abandoned. The children of Chernobyl. The children of the atom. The children we try to forget.